We've all been there. You go to the hospital to get a procedure done, and everything goes great. And you expect that your insurance company will take care of most of the cost and that there won't be too much trouble putting this behind you. Well, the next thing you know, you are inundated with bills that you don't understand. You don't know if you need to pay them, if insurance will pay them, and then you start getting more and more bills, and they just keep coming and everything gets really confusing. And that takes time away from your family, from your job, and from the things you want to be doing. Well, Abbie Leibowitz helped create a company that sought to take the confusion out of health insurance. So when this happens to you, you just call a health advocate and they'll take care of it for you. The business has been a huge success, with thousands of corporate clients who rely on Health Advocate to help their employees get better care with less confusion, so that they can stay focused on the things that matter to them. Our guest today, Abbie, is going to share his story. He's going to share how he started the business. He's going to share about his early career as a pediatrician and a whole lot more. You're going to learn a lot of interesting tidbits and maybe some lessons on how you might go about starting your own business. I think you'll get a lot of value out of the interview. Here's our conversation with Abbie Leibowitz.
Welcome to the Invest Smarter podcast, where we'll simplify investing and provide actionable ideas to help you navigate the markets and own your future. From retirement planning strategies in plain English to timeless investing wisdom, we'll cut through the noise and leave you a smarter investor by the end of every show. All content within the podcast is for informational purposes only and should not be relied upon for investment decision making.
So, good morning, everybody. I have Dr. Arthur Leibowitz, sometimes known as Abbie Leibowitz, who's had a great career in the medical industry and insurance industry. He's an entrepreneur. He's a doctor, and I've known Abbie for 40 years. I think you were probably my second client when I got into the investment business. So Abbie, please tell us a little bit about yourself, and then we'll get into some questions.
Yeah, sure. Hi, David. Well, first of all, I'm a pediatrician by training. We could probably spend hours just talking about that experience, but I was in a pediatric practice, and the practice was growing. After 12 years of managing the practice, as well as being the one of the primary physicians in the practice, we grew the practice to ultimately a 7-person pediatric practice. And I was offered an opportunity to work with a new HMO. I had no idea what HMOs were, but we had joined what was then called HMO Pennsylvania when it was first started in the early 80s, and became the largest pediatric practice in the HMO. And they were looking to add some part-time medical directors at first, and then that grew into a full-time position. And in 1987, I left practice and became a full-time medical director at what was then U.S. Healthcare. Was at U.S. Healthcare as a network medical director, doing all kinds of activities within the managed care world, and we were really building managed care. I mean, if you take yourself back to the mid 80s, it was pioneering work, and I ultimately became the chief medical officer at U.S. Healthcare. U.S. Healthcare and Aetna merged in 1996, and I was the chief medical officer at Aetna. And in 2000, decided to leave and brought together a group of people that I had worked with. And we sat around a table and just had a lot of coffee and a lot of breakfast and talked about what we wanted to do next, and came up with the idea that became Health Advocate back then. So
What's that?
It's been a wild ride.
It has been a wild ride, because I've been watching this all the way through. So when I first met you, you were directing Drexel Hill Pediatrics, and you're saying that during the time, I guess HMO PA approached you, and then your practice became the largest pediatric practice in the HMO. Is that what you're saying?
Yeah, Yeah. So it was interesting because uh, so many the HMO was building its network of practices so quickly, and practices were literally numbered according to the time that they got admitted to the HMO, starting with number one. All right.
You.
And we were office number 70, I think 76 or 77 or something like that. And on the day that we got admitted to the HMO, I think there were 40 different offices admitted. So we could have been anywhere from, number 40 to number 70 on the list. So we were one of the early adopters. And I remember, talking about it with my partner at the time, Joe Mariello. And, I said, I have no idea whether we should do this or not. And neither did he, but we decided to take a flyer on it. And it was ultimately very, very successful for our practice. And later, of course, for me professionally. So, just a fortuitous thing, a knock on the door, and right place, right time.
Wow. So back up. Where did you go to medical school?
So I'm a Philadelphian,
Okay.
grew up in the city, and went to Central High School, went to Temple University undergraduate, and Temple University Medical School. I did my pediatrics at Children's in Pittsburgh, and then when I finished, came back to the city and hooked up with an older pediatrician, was looking for a young guy in his practice, and we started out in Upper Darby. In 1980 we moved over to Drexel Hill, and the practice kept growing.
That's great. So when you were in this interim period where you were connected with U.S. Healthcare, and then before you moved in, what was that experience like? And then once you got into U.S. Healthcare, what were you doing there as chief medical officer?
Yeah, so within the context of the pediatric practice, there's always, like, the equivalent in a law practice of a managing partner. There's always somebody that's kind of running the practice in addition to, in our case, seeing patients. And I worked with a great group of people. But we had I had joined an older fellow in practice. And we subsequently just needed more help, and kept adding to the practice. My good friend Ray Fabius joined us in 1980, and as things grew, the role of managing in the practice became more and more important, and I was doing that, and I had a day off a week. So I was approached originally by one of the medical directors at the HMO to say, would you like to work for us one day a week? And I had a day off, so I said sure. That sounded like fun. And the role was going out to physician offices and talking to them about the HMO, about managed care, about their practice, and getting contributions from them, ideas that we could take back into the model. That went on for about a year and a half, and at that point they came and said, okay, we're going to add another medical director. Would you like to add another day? Well, I had only one day off a week. So we juggled our schedule around, and on the day that I worked, that second day for the HMO, I worked into the night till 11, 12 o'clock at night, seeing patients in the practice. And I knew that couldn't last forever. So
Sure.
after about 9 months of doing that, I moved into a full-time role at the HMO. And the job was largely the job of what you'd refer to today as a network medical director, which not a lot of managed care plans really still do. Most of the medical director roles inside managed care today are utilization based roles and utilization management roles, so which really wouldn't have interested me. But I was a network medical director. We divvied up the area. I was in charge of expansions into new states, and just generally working on the reimbursement model, the reimbursement structure, the policy development and things that when we decided that we needed the title of a chief medical officer, I was fortunate enough to be selected to have that role. So at that point, U.S. healthcare had expanded into Connecticut and New York and New Jersey and Delaware and Maryland and, obviously all of Pennsylvania. And so it was a matter of kind of playing the glue that tried to hold that system together, that program together, and making it successful.
I recall, watching U.S. healthcare stock perform wonderfully during that period of time, I think, when you were there. What changed? So we're going back into the 1980s, and people might be wondering, what was the concept of an HMO, and what was it replacing, and how did it affect physicians and patients?
Well, okay. So the model for an HMO was not new. I mean, the earliest HMO model of significant success, of course, was Kaiser, and actually the Permanente Health Group. But the Kaiser model was a contained HMO. Kaiser was launched around the end of the war. To serve the workers originally at the Kaiser plants, but it grew as a fully contained HMO. So the HMO owned the hospitals, they owned the physician practices, they employed the physicians, and members came into the system, and it was a relatively speaking closed environment. You got all your care within the HMO model. In the 1970s, 1980s, people, it was actually part of the New Great Society program to enable or foster the development of HMOs as a means of controlling medical costs in the country and improving the quality of care. And the enabling legislation was actually signed by Nixon that enabled the HMO to require large employers to offer an HMO option. It's called mandating. And one of the famous stories was when U.S. Healthcare, or HMO Pennsylvania, mandated Blue Cross of Pennsylvania to offer their HMO to the Blue Cross employees under the mandate law. But it was a matter of trying to restructure healthcare in the United States. Really a task or a problem that's still ongoing, if you look at it that way. And it was trying to work with doctors in a different way. The model that we had was what was referred to as an individual practice association. So we didn't own any practices. We contracted with doctors to participate in our payment model. And the unique thing about it was the way that it was based on a fee schedule rather than a percentage of charges, that it had certain obligations on the physician's part and placed, to a certain extent, some risk on the doctors because they were paid under a capitation, which was truly a unique situation for virtually all the physicians, especially early on.
So what that would mean is that the doctors would get paid a fee per client, regardless of what treatment they get?
The idea was to pay the physician to care for the patient, regardless of what that cost, and to develop that fee based around what good care should be, and discourage people from bringing people back to the office unnecessarily for the opportunity to generate more revenue, or admitting them to the hospital for the opportunity to generate more hospital revenue or whatever, and kind of flip the model to say, here's what we'll pay you, take care of this patient, do whatever the patient needs, and try to do it in a way that provides the best possible care, and that should allow you to profit under this payment model.
So the new payment model sort of was evenly distributed amongst all the patients, and so some patients needed more care, others needed less, but everybody paid the same.
Yeah, although there were age bands, so
Okay.
what you got paid for a 2-year-old was different than what you got paid for a 12-year-old. What you got paid for a 26-year-old was different than what you got paid for a 55-year-old.
Sure.
So
So while you were at U.S. Healthcare, what happened to U.S. Healthcare, and how did it grow?
Well, so the company grew to, first of all, it, as you mentioned, the stock, but basically the stock simply mirrored the fact that the company was extremely successful in both the competitive world, selling its products in the marketplace, working to constrain medical costs, and expanding into new markets. So the company itself was just a great business model.
Mhm.
Um, at the same time, it was a regional player, and increasingly, as the program was attractive to national employers, originally national employers based primarily in the Mid-Atlantic and Northeast. Those national employers were looking for solutions across the country. And Leonard Abramson, who ran U.S. Healthcare, was the CEO, founder, president of U.S. Healthcare, I think recognized that we had to do something to become a national factor. Aetna at the time was looking to get into managed care. And ultimately, after a number of fits and starts around the relationship, a deal was struck, and Aetna acquired U.S. Healthcare in what was referred to as a merger, in the sense that the U.S. Healthcare managed care model was the model that would be the Aetna model going forward.
So, how long were you at Aetna?
So we had an obligation to stay at Aetna for 4 years after the merger. And we had an obligation to stay for 3 years that extended itself into a 4th year. And when that time was up, I just felt like, it was time to do something different. And that's when we started looking at other opportunities.
Yeah, after that, you were at Medscape.
Yeah, in the transition, I was as we were talking about health advocate, ultimately what we were going to do. I was asked to be on the board of a company called Medical Logic, which was an electronic medical records program company that had acquired Medscape, the online physician-oriented medical website. And I did digital development for them. We were trying to, honestly, we were trying to develop additional financial streams for Medical Logic. And we were successful doing that, but we couldn't generate money as fast as the company was spending it. And ultimately, we split the company and sold it off. We sold the Medscape website to WebMD, and it's still a very prominent website. And we sold the electronic medical record program to GE Health, and they still have the EHR.
So after that, then what happened next, and how did this health advocate? How did it come to be?
Yeah, so we had a Mike Cardillo, who had been the president of the health business at Aetna U.S. Healthcare, left right at that 3-year mark. And when I knew I was leaving, I called Mike on the phone and said, what are you doing? And he wasn't doing much. It was summertime, and he had sold his house in the Philadelphia area, moved down the shore to his shore house. And he said, it's beautiful on the beach. And I explained to him that winter was going to come, and we needed to find something else to do besides walk on the beach. And we started just talking about ideas, and we decided that we were going to take a blank slate to it. I mean, we looked at anything. We looked at there was a Krispy Kreme franchise available for Philadelphia, for southeastern Pennsylvania, southern New Jersey, and Delaware. We looked at that, but we realized that donuts weren't in our future. I don't play golf, but we went up and looked at a golf course that was for sale, and it only had 9 holes, and I knew that there were more than 9 holes on a golf course, so that didn't pan out. We met a guy who manufactured athletic exercise clothing. This is one we probably could have pursued, using a DuPont fabric called Cool Max. And we invited the guy to come talk to us, and he had his suitcase full of t-shirts and underwear and gym shorts and all this kind of stuff. And we actually went to talk to Cy Sims. Remember Cy Sims?
I remember Cy Sims. Yes.
We went up and we met with Cy Sims, and we brought samples of this athletic wicking material. And Cy Sims said, it's polyester. Nobody wants to wear polyester underwear. And he threw us out of his office. And of course, today, that's the whole Under Armour athletic leisure wear world that maybe we could have had a part of. But we kind of kept gravitating back towards healthcare because we knew it well. And we thought there was a market for a company that would help people deal with healthcare issues. And we figured that, with my background on the clinical side and our overall experience on the administrative side of understanding benefits and insurance and how things worked on the inside, that even if we didn't know anything, we knew more than the average person. And we took an office in a gardener's tool shed at a restaurant up in Horsham that had some bungalows out back that they rented out, became our first office, and ultimately moved into an old abandoned warehouse in Conshohocken.
I remember.
And we said, hey, we're a company. It's sort of like the first issue of a magazine. You open it up and there are already letters to the editor. It's like, who knew to write? But the group ultimately coalesced around 5 of us, and Marty Rosen was our marketing guy. David Ricchino was our sales guy. I was the medical end. Mike Cordillo was the president, and we all did sales. And Tom Massey was the finance guy, and everybody was on the road and just trying to talk up what we were doing. And the hardest thing was explaining to why people needed what we were doing. Nobody had ever heard of the idea of a health advocate before.
So what was the thought? What was it you were providing?
Well, it was really, we did it very open-endedly to describe it as anything that you need help with relating to your health, come to us. So Marty sent out mailers, letters to everybody he knew, which was most of the world, certainly most of New York, and all of our family members, describing that, we were there to help them with any health issue. And not surprisingly, ultimately, the phone started ringing with people telling us about their problems. And so that was pretty much what we were doing in 2000. We went live for our first commercial client on January 1st, 2001. And we took the array of phone calls that we had gotten from this, family and friends relationship that we'd struck, and we said, "Oh, look here! Look at what people were asking us to do," and it broke down, about 60-40 into people calling us because they had issues with their health insurance. They didn't understand their benefits, or they had a claim that they thought should have been paid differently, or they wanted coverage for some crazy kind of treatment or whatever. And then about 40% of the calls were about, I've got I've got arthritis. I need a second opinion. What is diabetes? You know, all the medical side of things.
Right.
And that still holds true to today. I mean, basically, we divide the world into two sides: the administrative side of medicine, all the stuff that gets in the way of trying to get care and use your benefits, and then the health side, which is helping people directly with a health issue. And they're connected because ultimately, the reason that you have a benefit is so that you can get help on the health side, and ultimately you get help. And you go to a doctor, you have a problem, you're going to get a bill. And so the two pieces are obviously connected, but it sort of declared itself. The audience told us what it was that they wanted us to do.
So there was a natural market there. I remember when you started that, and I was involved as an investor, that the story was that people are working and doing their jobs, and then they find out that their wife or their mother has some sort of cancer or some medical issue. And now this person is sitting at his desk, but he's spending his entire day trying to figure out how to get the right care, get the right doctor, get the right insurance. Why isn't the insurance covering this? I don't understand why I'm getting this bill. And I know from experience that is extraordinarily frustrating and very non-productive. So
and that became a big part of our sales pitch. The idea that we would take all that off the shoulders of the employee and allow the employee to focus on their job, focus on their family and their life, while we dealt with those issues behind the scenes. And I kid people, it's not far from true that we started Health Advocate because I realized that managing my mother-in-law and my father-in-law's health issues was a full-time job. And just like anybody else, I needed some way to have some help with that.
And you're a doctor, and you worked in the insurance industry.
Yeah, and still, it's just not easy. I mean, it can be all-consuming, let alone the stress of having an ill family member or what that brings. So, yeah, the productivity story. It was after 9/11, so people had an understanding of human cost, the human tragedy, if you will. And there was a little different employer perspective about their employees. And certainly that contributed to our success. But it took us 15 months to get 12 clients. And they were small.
12 companies, 12 people?
12 companies.
Okay.
And, there probably weren't, in those 12 companies, there probably weren't 200 employees. It was, our first customer, if you call them a customer, was the carpenter that we hired to put up shelves in our warehouse, and I think we paid him in options in the company or something like that. And John the carpenter was our first client, and then the lawyer that drew up the corporation papers became the second client. And it was guerrilla marketing, but things really took off. And the company ultimately became cash flow positive in 30 months and profitable at 3 years, and has been profitable every year, every quarter since. So great story.
So what did you do to make Health Advocates so incredibly successful?
I think, as I said before, a lot of it was just to be at the right place at the right time. Although it was probably the worst economic condition that the country up to that point had seen in like a decade.
Right.
But from that grew an increasing awareness of the cost of healthcare. And we were telling, the productivity story, as well as the idea of making the healthcare system a little more efficient, so that especially for self-insured employers who pay the bill directly, and for fully insured employers who are subject to their experience triggering their premiums, that we could help to reduce the cost of healthcare. And that certainly resonated in the marketplace. But I think the biggest thing that we were selling was our sense of compassion and understanding at the level of our staff, that you would get in touch, you would get connected to a human being that we referred to as a personal health advocate, who would stay with you, from the moment that you brought an issue to us until you said we're done. And that could be a day or a week or a month or a year. And it was truly a different kind of model. It was a different level of personalization of healthcare against the backdrop of a system that is not, still is not today, very personal.
Yeah, I
So
mean, as a member of Health Advocate and having used it, there was a tremendous sense of, oh my God, I've found somebody that can actually help me and understands what I'm doing and can actually go to the insurance company and, you know, argue my case, whatever it is. That was just a big, huge relief for me personally, and I'm sure for everybody who, you know, got involved with that. I was amazed at the level of personal attention and care that you felt.
yeah, I would tell you it still continues today. You know, from that same start, going back to 2020, 2021.
Wow. So give us the history.
20 to 2000, 2001.
So that's a 20-year run right there. So are there any highlights that you remember that stick out in your mind in any part of your career? And also, I want to go back a little bit to what ultimately happened with Health Advocate.
Yeah, so you know, it's been a great journey. I met some wonderful people along the way, some great friends that are my, you know, my circle of friends today, from every aspect of my my past. You know, there are certain things that certainly are the milestones along the way. Obviously, the pediatric experience, and I loved it. I mean, I never left practice because I didn't love practice. I left because somebody presented an opportunity. It seemed like an interesting thing to do, and my wife reminds me that I was 40 at the time, and so, you know, it was my midlife crisis or whatever. But you know, if somebody had come around and said, well, you got to go back to practice now, this managed care thing isn't going to be real, I would have happily gone back to pediatric practice. I love pediatrics and still try to keep up with it and do all the things I do for my licensure and my professional development. So certainly that's, you know, one block. And then the move into the step into managed care, the step into U.S. healthcare was certainly a second, you know, second great aspect of my career. Becoming the chief medical officer was a big highlight, and then getting the group together and taking the idea of Health Advocate into the marketplace. Interestingly, the two things marry up some. So one of the significant development tracks for Health Advocate was the idea of data analytics. So from the very beginning, we trained our staff to ask what we refer to as the hidden questions. So if somebody, you have to appreciate, when we were talking to employers, while they understood what we were doing, the real value that they attributed to our work was what we could do to help people get better care. We realized quickly that the majority of the calls that we were getting had nothing to do in the mind of the caller about getting better care. It had to do with a bill or a claim issue or a coverage issue or a benefit issue. And so we needed to swing that around. We needed to convert that discussion into a discussion about health, because that was the value that the employer or our client was attributing to our service. So we would say to somebody who presented, let's say, a bill for going to the emergency room that they thought was processed incorrectly. Nobody ever calls us because the bills are right. I mean, we don't get the call that says, hey, I just want to tell you, Blue Cross paid everything right. I don't have any problem. We don't get that call.
I just have to interject at this point. I mean, whenever I've had a medical issue, these bills just come out of everywhere. I don't know why. I don't know what my coverage is. I don't know what I'm supposed to pay, what I'm not supposed to pay, because you're getting it from so many different angles.
Yeah. And you don't know. You know, what I tell people is never pay a bill, never pay a first one. There'll be a second one. It'll probably be different, probably be closer to right. And if you got any questions, you got to call. And obviously, if you have our service, you can call us. But so we were doing this. You went to the emergency room, you have the claim, I'll look at the claim. Why'd you go to the emergency room? All right. And then we could get into the health issue. I thought it would be nice to know, for example, that the person we were talking about was a diabetic, for example, before we asked them. And so about 12 years ago, we went out looking for a way to develop data analytics, to take in medical claims data and produce a profile of every member. And we had done that back at US Healthcare in an organization, a division of the company we called USQA. And one of the guys that had been formative in that role was Antonio Legarreta, who had left and ended up in California doing data analytics. And Antonio had sold his company and was looking for his next opportunity. And we hired him to develop a whole data shop for us. It's now 25, data savants, data engineers, great intelligence and understanding of how you manipulate large data sets. And that transformed Health Advocate, so that today I refer to us as a company that uses data about an individual to try to identify opportunities to motivate that person to take steps to improve their health. And that's really what the marketplace has moved to. So that's clearly a milestone in the whole development of the program.
Well, it sounds like what you did is you had a pretty good composite of each member, and so you had a starting point for their health treatment options. But the patient himself, I'm sure, felt this relief that somebody understood what they were going through and how to handle all the bills. And so
yeah. We get great comments from our members, unsolicited. We just get great feedback from them about the help that they get from our team. And
I would be certainly a positive on that as well, for sure. So what ultimately happened with Health Advocate? How did it grow? What did the membership look like when you started? You have 0, but what happened over the years and to the ultimate sale of the company?
Well, so the company grew. Today we have about 12,500 clients.
Wow.
They range in size from tiny little companies. I think our smallest group is 1, which technically isn't a group, but to enormous, national companies in virtually every field, from retail to finance and manufacturing.
How many members?
We get paid on about 12.5 million people. There's some overlap in terms of products. Today, where we started with just this concept of what we refer to as advocacy, today we actually bring about a dozen different services to the market that we blend together for clients. We have a wellness program. We're one of the largest employee assistance programs in the country. We have a work-life program. We have a disease management program. We do all this data analytics. So the company's, the product mix has grown both in breadth and sophistication. And in a competitive way, it's kept us competitive in the marketplace as well. And we continue to look for opportunities to keep building that out. It's certainly, the need is there to keep growing, and that's what we want to do. So I don't think the Health Advocate that you see today looks very much like what you might have seen 20 years ago or 10 years ago, and I don't think it looks a lot like what it will look like in 3, 5, or more years down the road either. It was obviously a milestone when we sold the company to West. West was a large telecommunications company that nobody had ever heard of. They owned a lot of the pipes, a lot of the infrastructure for telecommunications, consumer marketing, consumer assistance. If you make a 911 call on your cell phone, it goes through West.
So that would not be considered a strategic acquisition.
Yeah, they bought us for to expand a footprint into healthcare.
Yeah.
Didn't quite work out the way I think either they or we thought it would. But at the same time, we obviously we had a financial opportunity, and West provided a good landing place for the company.
Mm.
West itself got into some urgency around the business model and was sold to Apollo Global Management,
Mm.
um, and renamed then as Entrado. And Apollo recognized that Health Advocate was not necessarily a strategic fit for the other parts of Entrado. And we went into the marketplace and ultimately found a new home in a company called Teleperformance, which is a French company. Their largest holding in the States is that they own Language Line, which is a telephonic translation service out on the West Coast. So Health Advocate and Language Line are kind of the teleperformance anchors in the US. And we're still waiting for that deal to close. It's pending a license transfer approval in California, which we expect will happen at any time. And we think that that's it's certainly a better place to be than to be within the constraints of a place where you don't really fit well. And in a private equity sense, I think there isn't a lot of interest in necessarily growing the business that way. So I think we'll be in a good spot going forward.
How did Health Advocate do upon the acquisition by West? If you go back to that point, did it continue to grow?
Yeah, we did. We did continue to grow. The company's grown at about a 10% clip year over year in both, revenue, EBITDA. We're very profitable, which is one of the attractive parts of the business. Although we can, one of the realities of today's world is that we compete with a bunch of people who not only are not profitable, but have no interest in being profitable, who are the darlings of the stock market at the present time. And, it's hard to compete, and I don't mean to disparage anybody, but it's hard to compete with an irrational competitor.
Well, can you give me an example of something like that?
Well, yeah. So we compete with Accolade in certain lines of business, and they've got a multi-billion-dollar market cap and have never made a penny in profit, and don't really show a lot of successful movement towards that. So
Well, we see all sorts of things in the market today that don't make a whole lot of sense in terms of, I mean, I don't want to digress, but there's so many examples of Reddit and people ganging up and like buying out short positions and driving stocks that should be going bankruptcy into the hundreds. And so there is a sort of a disconnect between what companies are doing profitability and outlook wise versus their stock price. There seems to be a huge disconnect at this point.
And we are a company that does make a profit and is focused on being profitable. I think it's a core tenet of business. And if we do our job well and compete well, we should be profitable. So that's kind of the world that we live in today.
Yeah. So we have like 3 more minutes to go over a couple of things, and I would like to ask you to tell me why someone should sign up for Health Advocate. Let's say, if I guess now it's corporate sales. So a corporation, why would they want to hook up with you?
Well, so if you take the situation of a client that we're pitching right now, they're a large corporation. They have employees in 30 different states. There isn't an employer in the country that sits back and says, well, healthcare is getting more and more difficult and confusing. I'll hire more people in human resources and benefits to take care of that. So they're up against the fact that they know that managing this complexity is not a core competency. At the same time, they want a program to try to constrain medical costs and improve medical care. It's a highly competitive world for employees and employee attention. So they want their employees to be productive at work and not spend a lot of time doing the kind of things that we're talking about Health Advocate doing for them. So there is that focus on productivity. There's also a focus on providing a good benefit, in the competitive world of attracting and retaining employees. And they're looking for simplification of the model. They're looking for somebody that can come in and take it all on, so that to the user, it's a seamless process, that you don't have, the typical large national employer gives their employees a benefit book that's got 25 different programs and 25 different phone numbers and websites. And nobody can keep that straight. It's no wonder that people don't use their benefits effectively and efficiently. So, give us a solution that simplifies all that. And that's what we do. That, you can come in, a single point of contact, one phone number, one website, one place you call, and we'll get you to the right place. If it's not us, if you're using somebody else's wellness program, we'll get you there when it's the right time to get you there. But we'll simplify the process. We'll kind of be the master vendor in the relationship, and just create a sense of not only efficiency but effectiveness in helping people use the healthcare system. That's the sales story. That's the pitch.
Yeah. Yeah. And some of the individual who works at the big corporation now feels a sense that, oh my God, somebody understands what's going on here.
Yeah.
Versus the alternative, which is I'm completely lost.
Yeah. I mean, it's take it off my shoulders. And, a lot of those people are the same people that need our service personally. So.
Has there been any studies done that shows increase in productivity by having this taken off the employees' hands?
Yeah, there has been some work done around the other way, which is time spent by an employee dealing with healthcare issues, and by inference, if the employee didn't have to do that, they'd be more effective at work. We measure our time, so we figure that the hours that we spend are hours that the employees and their family members don't have to spend.
Yeah.
And we report that back to our clients, to show them the activity level that we've created. And to the typical, so it really varies by clients and how they structure the relationship with us, which products they're using, and how they place us in their hierarchy of different programs and vendors. But in the relationship, we can typically show that the value of the time, just flat out, the time we save employees, if you value that time, exceeds anything. It exceeds the cost of our program in and of itself.
I would imagine it would exceed it by some logarithmic function.
Yeah.
Because I know people that have had health issues and they're spending half their day trying to figure out how to help their mom or sister or brother, and and mentally they're not focused on the job. They're, how do you measure that? I think it's been great ever since. It's expanded beyond anything I recall when we first started, but I just think it's fantastic.
Well, thanks. We wake up every morning and go to sleep every night and feel good about helping people. So.
That's great. Well, listen, we're out of time now. So Abbie Leibowitz, I really thank you for your time. It's been a great journey for you. You created a fantastic company. And I hope people that are listening to this get something out of it and maybe learn how to help deal with insurance companies when you have a medical issue.
Right. Thanks, David. Take care.
Thanks, Abbie. Great talking with you. Bye.
Email us at investsmarterpod@gmail.com with questions to be highlighted on the show. Thanks for listening, and keep investing smarter.